Hello everyone, let's continue our discussion on the comorbidities which is found in cerebral palsy patients. This is the part 2 of it. We have already talked regarding the common problems of fever and seizures. Now again a very common entity which I am trying to discuss now is diarrhea. So diarrhea, what is diarrhea? Diarrhea is the passage of watery stools which is increased in frequency, which is more than 3 times in a day. Okay, and along with frequency, it is the consistency changing to watery. Then the child is said that the child is has diarrhea. And what are the common organisms? Most commonly it is viral in etiology. Rotavirus causes it, and it could be bacterial even, which is caused by E. coli. So, how to identify that the child is having loose stools or diarrhea? The child has increased watery stools. The child might be having abdominal pain, like you can see in the photograph. The child is very irritable, very lethargic, is not feeling like eating anything, and also if you've had something from the outside, uncooked or something. A junk food you have taken from the outside, and maybe after breastfeeds also it can occur. Most important, always give your doctor history if there are any medications that you have taken after which this diarrhea has started. So once diarrhea is identified, you need to manage it. Before going to the doctor, you need to realize that there are few things which you can start yourself, in which the most important point is rehydration. Rehydration is giving the child all the fluids as much as he requires orally, which he has lost through his stools. And most important way how you can give it is the ORS. WHO ORS, there are packets of ORS which are available, in which you have to open the packet. One packet needs to be mixed in 1 liter of water and should be consumed within 1 day, 24 hours. Or it can substitute water. You can take water or you can take ORS. ORS is a better one because it has all electrolytes. It gives energy also because it has glucose. So this is a very important, most important management of diarrhea, which can be started at home. Secondly, what things you can eat or what things you cannot eat is a very important question. So in the photograph you can see that always one must eat things which are very light. Very light when you are having a diarrhea. So diarrhea is when your intestines get involved and they are not able to absorb. If you start having very high protein diet at that point of time, very big fruit, big bowl of cereals or something, the child will not be able to have. So very simple foods like banana and curd. This is the most important key for diarrhea. A simple khichdi can do, which we can make at home, porridge which we can make at home, simple cereals which we can make at home with less water and a little on the semi-solid side, and a simple bread, not having too much of oils in it. Egg is also quite easily digested. It is a very good, and it is a very good source of protein. So if the child likes it, one can give. Also, this rehydration should continue. Each loose stool should be given oral ORS. One must take, now instead of, if you are not in an area where there is an ORS or a pharmacy are available, simple things like coconut water. It's the best source of electrolytes which can replace water. Dal, pani or rice water is also a very important substituent, something which you can take instead of giving ORS. And foods like banana, yogurt, curd rice. Curd rice is a very good option to give when the child is having loose stools. Now again, like we discussed in fever, there are certain danger signs which are associated in diarrhea. Some signs which are happening with diarrhea you need to take care of, like if the child, instead of being, might become very irritable, or the child has become lethargic, which is he is very fatigued, he is not able to talk to you, he is not getting up from the bed, he is not interested in his surroundings, he is having sunken eyes, he is not passing enough urine. If you see his skin has become really dried with a dried tongue and mucous membranes, then you need to urgently go to a doctor. This is not something which you can treat at home. You can treat by oral fluids. The child requires IV fluids at this point of time. Also, some conditions might be complicating the diarrhea, like the child might be having fever along with it, or a distended abdomen which is very tender, which is very painful to touch, and it has lasted for more than 3 days, or there are blood in stools, the child is refusing to eat anything. This is the time to urgently go and visit the doctor. A very important condition, a comorbidity found in patients of cerebral palsy is Gastro-oesophageal reflux. Now, what is reflux? This is, how do you identify it, is that the child, whenever you are making the child eat something, the child spits it out. He has regurgitation of feeds. He is having pain in the upper abdomen. He is repeatedly coughing after feeds. He is vomiting. And even though he is eating, his weight is not increasing. These are all the indications that the child is having GER or reflux disease. How do you treat it? Most important is how you feed the child. In cerebral palsy patients, it is very difficult to make the child upright sometimes. The tone is too high. But you need to try as much as possible to keep the head upright while feeding, burping after feedings. Just after giving the feeds, do not make the child lie down. Burp him after the feed and keep him upright at least half an hour. If he is an older child, try and keep him in a chair in which he sits. And one might go to the hospital, go to the doctor and start on some antacids, antiemetic drugs. Even surgery is possible in certain cases. A very important condition, drooling of saliva. So most of our children have this tendency that the saliva droops down from one side of the mouth. How can we help them? Their muscles are very either too tight of the mouth or they are too loose, and hence they are not able to swallow that saliva and it comes out. So physiotherapy, here the oral muscles are also, they undergo physiotherapy which is very effective, and sometimes ice cubes are also told, but be careful when putting them. But if all these things are not working, there are certain drugs which help to decrease these secretions. Next important problem which we face is failure to thrive. Now, when do you call? Even the child has become 5 years of age or 3 years of age and his weight is not increasing. At 5 years also he is 10 kgs only. He was 10 kgs at 3 years, 10 kgs at 5 years. His weight is still very less for age, or his height has not increased. Then even over 6 months his weight is not increasing even if you are making the child eat. That is called as failure to thrive. So how to identify? No increase in height or weight. His weight is height is very small for age. For 5 years he is very small, still looking like a 1-year-old child. Very thin. The arms and legs are very thinned out. Thinning, and the hair. You start looking at the hair starts to fall off. The skin is very dire. The child becomes very lethargic. He is not responding very well. His appetite has decreased. He is having continuous vomiting. That is when you suspect that your child is having failure to thrive. Treatment. We have always read that our diet should be balanced diet. It should have everything as possible. CP child might not be able to eat everything, but we need to supplement that in diet as much as possible. From the picture you can see berries, vegetables, everything has been made. So how can you do that? So a proper balanced diet in these children requires good protein and good energy. Good protein comes from sources like dal, legumes, soya bean, egg. These are very good protein sources. You make them, you can even make them very liquefied form, a semi-liquid form, and give them. Similarly, once you have given this, still energy will not come so much. So for energy, you need to add a little bit of ghee or oil in it. In the roti, if you are giving ghee in it. These are normal sources. So makhana is a very good source in which you can make a kheer and feed them. Above All this, if you're doing all this, still the child is not gaining weight, then we need to look for some underlying systemic illness, some other infection which is happening, or some loose stools which are happening on off and on. That we need to do. For energy, there are various other sources, and most important, most commonly you can give is banana. Banana has a lot of energy. So 2 bananas a day, if you are giving up in the morning and evening, it is of great, gives a lot of energy to the child. Vaccination. So vaccination is very important. We have vaccines for number of diseases now. So many diseases can be prevented by only giving vaccination at the proper time. Visit your pediatrician and give proper vaccination at the right time. Visit your doctor if you because there are some deficiencies which only the doctor can recognize. Deficiency of iron, some very important vitamins, vitamin A, vitamin E, vitamin D, calcium deficiencies. These require supplementation. Only the doctor recognizes it and tells you. Very important problems, visual and hearing impairments which are found in cerebral palsy patients. So you can see children are there who are having this squint where the eyeball moves to one side, or the eye continuously moves, which is called nystagmus. Then there may be refractive error problems that the child is not able to see distant visions. So all this requires screening. The squint might even require surgery. Very preterm kids, please get a ROP screening, which is retinopathy of prematurity, needs to be screened by a proper ophthalmologist, needs to be screened and treated if present. Next, hearing and speech. So hearing is very, very important, because if the child is not able to hear anything, he will not be able to speak. So one needs to get hearing evaluation done very properly. There are two methods, and your doctor is the best judge of what is required. He will tell you. Whenever the child is having delayed speech, the first test to do is a hearing assessment. Please opt for hearing aids if the child is not able to hear properly, or if the child is less than 1 year, then there is something called as a cochlear implant which can be put. Very important problem of bladder and bowel. These children have constipation. Cerebral palsy is very, very common in cerebral palsy patients have very commonly constipation. What is it? Passage of hard stools, difficulty in passing stools. The child does not pass stool even after 3 days or 5 days. Very, very important to treat it. Painful passing of stools, nausea, abdominal pain, vomiting. How to treat it? Give plenty of fluids. As much fluids as the child can have, please give. 6 or 7 glasses of medium-sized glasses should be had by a child of 5 years or 6 years. High fiber diet, along with having dal, roti, sabji, salads are very, very important. With our normal diet, supplement with salads like beetroot, cucumber, tomato, everything is required. Fruits are required. Milk predominant diet needs to be discouraged. Milk needs to go down, foods need to come up, and increasing the solids. If not relieved by any of these dietary changes, visit a doctor, start laxatives as required. Secondly, bladder disturbances causing recurrent UTIs, urinary incontinence. So what is UTI? It's a urinary tract infection. How do you recognize it? The child cries during micturition, cries during passing of urine, or there is burning micturition. He has fever, the urine is very frothy, very differently colored, having very bad smell. There is a lot of pain in the lower abdomen. He goes to the bathroom regularly, very frequently. That is a urinary tract infection. How does one treat it? A lot of clean fluids, plenty of clean fluids. Clean fluids are very, very important. So if you are not having access to it, get a packaged drinking water, but it should be a clean fluid. Then at the same time, juices like cranberry juice also help in urinary tract infections. And you should make the child understand that when the child feels the urge to urinate, please go there and then. One should not wait or hold the urine. Always after urination also you should wipe, the parent should wipe the urinary area from front to back in females, and keep the area clean. Even after passage of stools, keep the entire area clean or there will be infection transmitted. Visit the doctor and start treatment if there is fever, if there is pain, in the lower abdomen, requires treatment. Very important thing which is found in cerebral palsy patients is respiratory problems. Now these children require, repeatedly they come with cough, cold. The child is repeatedly having cough. 2-3 months he gets okay for 15 days, again starts to have. Many of these children require repeated nebulizations, which is when you give you have to nebulize the child and it has to reach directly the respiratory tract, and the oral medications are not effective enough. So why is that? This is cerebral palsy patients have an increased tendency. Their respiratory muscles are not strong enough. That is why they continuously start to have coughing, and this coughing might even increase after feeds. So if you have made the child eat something, please do not make him lie down. This aggravates the coughing. Repeated regurgitation. GER, like we had talked before, reflux leads to regurgitation. Regurgitation causes coughing, and hence burping is very important after feeds. So these are all the factors and some red flag signs which I have shown. So risk factors which we've already discussed is the muscle tone, which can be changed through physiotherapy. Reflux disease, which can be treated, and you can do some modifying in your feeding practices. Then if you are getting repeated infections, then it has to be treated as prudently as possible, giving antibiotics for a good time, but good coverage is also required. So a good antibiotic for a proper duration with a proper dose is the most important. Then seizures, how to control seizures, because whenever you are not controlling and the secretions are going to the lung, that is called as aspiration, that leads to increased respiratory problems. Then there can be when the child has a lot, the GMFSC score is too low, then the child is predisposed for recurrent respiratory tract infections. So one must take into account that he is predisposed to it and get treatment whenever required. A very important last topic of our discussion would be behavioral and emotional disturbances. So these are things which are not easily detected or diagnosed by the parents, because we tend to take them as a normal thing, that the child has a tendency to become angry, or the child has a tendency to fidget too much. But that is also one of the problems which are faced by cerebral palsy patients. So there is one problem of ADHD, attention deficit hyperactive disorder, in which children are very, very hyperactive. They do not respond to our commands. They are very impulsive. They have to have this at this point of time. So their tantrums are too much to handle. So this is a spectrum of ADHD. Second is a autism spectrum disorder, in which the child does not have any eye contact. He has a tendency to look somewhere else. He has no social interaction. He is fixed with his routine. He likes to do this in the morning, in the afternoon, in the evening. If you try to shift it, you try to go out of the house, he becomes very, very anxious. He is not happy. He has no emotional reciprocity. You are trying to communicate, you are trying to play with him, just make him smile, but he does not smile back. So these are part of autism spectrum disorder. Emotional liability is a part of it. Now these things can be countered. As we are encountering all the other problems, we are treating for them. Behavioral problems are very common. They are not recognized, but they should be. There is treatment which is available if done at the right time. The child improves 100-folds, because with the physiotherapy, with the occupational and the speech therapy, if you start doing behavioral therapy and he feels very good in his environment, then he responds better to all your other treatments. Hence, this would be our common comorbidities which we have discussed today, and hope this was a very informative and a helpful lecture for you.